Hi, it's Amy and Emily for the 16th annual ski program. This will be the home exercise program number 1 that you will be performing between weeks 1 to about 4 to 5 weeks. The things you will need for this class is a large fit ball. And then for banding, we need a band around your thighs. So we use these short loops. They're for sale here. You can go online and buy them. Green is a average. You can go to blue, which is heavier. You can go to red or yellow, which is lighter. And then in addition, you will need a long piece of threaded tubing for your upper extremities. Again, green is in the middle of the road, blue is more difficult, and red is easier. You can also take a long piece of TheraBand and create a smaller band for around your thighs. Just make sure it's tied really tight and short. Lastly, you will need 2 small weights between 1 to 3 pounds, and then 1 larger weight that could be anywhere from 5 pounds to 12 pounds. In this class, we also want to review what bone stacking and an efficient squat is, because we use the term ski squat. And a ski squat is a mini squat. It is not a giant deep knee squat. We try to protect your knees in this class. You can go deep if you'd like, but skiing is not that deep. So we train more in a mini ski squat. Now, the initiation into the ski squat is important. If you tuck your tail under and squat, you will put so much pressure into your knees and you will be quad dominant. You will also hit something on the trail and your disc will be compromised there. Many people squat that way. The other squat is sticking your tail up too high and lifting your chin. And now you can see that the knees are not over the ankles anymore, the ribs are flared in the front, and there's compression in the low back. Now if you hit something, you have compression in your low back, and the absorption is not coming through your entire lower extremity. So at Pinnacle, we talk about the ring stacking. So we want your pelvis to sit over the arches of your feet, your ribs to come straight down into the arches of your feet, your shoulder girdle just hangs. So yes, your hands will hang in front of your thighs, not in the back, that's normal. And then the head position is that your head is sitting on top of C1, which is like a little saucer, and your chin is a little lower than the back of your head. And that sits on top of the arches of your feet. Now, when you initiate a healthy squat, your knees go forward at the same time your tail goes back. There isn't a lift of the head or lift your chest. It is literally a simultaneous angulation between your hip joint and your knee joint. And Emily's showing a really good picture of that right here. So then the initiation is most important. So if we ask you to get into a mini ski squat and you get into it inefficiently, and then we load you there for minutes at a time, you're gonna hurt somewhere. So this is super important. So coming back to tall, and now when she goes into her mini ski squat, everything is right over the arches of her feet. She could bounce there, she could jump there. There's no back pain, there's no knee pain, there's no hip pain. It is okay that your knees go forward over your toes. Even when skiing, you push your shins into the front of your boots. So we are going to start with that. And when we say mini ski squat, that is what we need. This initiation has to be healthy. Okay, hopefully that's helpful. You can skip that after you've heard it once and go right into the next 10 exercises. So exercise number 1, let's set it up. You're gonna put a band around your thighs. You're going to have the big ball against the wall. And you may have small weights in your hands if you want, or you can go without weights, your choice. When you come into a mini ski squat here, feet are about hip width apart, and when you come into your squat, knees go forward over toes, tail is going back, your upper body is not wrapped around the ball, it's away from the ball, just your pelvis is into the ball. Hands are gonna be out in front of you like you're going down the fall line. You will come into a mini squat, and you're gonna hold this. So this is our warm-up. We're just gonna start warming a healthy squat. You can take your knees and open them a little bit, your glutes will fire, and then take your big toes and press them to the floor, and all of a sudden you have a simultaneous contraction around your entire lower extremity. There should be no low back pain. Your abs come on automatically. You don't have to actively engage them. And you're trying to approach this with allowing your shoulder girdle to be relaxed, even though your hands are out in front of you as if you're holding your poles. If you want to put your poles in your hands there, you can go ahead and do that, or have small weights in your hands, whatever you'd like. So this exercise, squat down and hold. You decide the depth of your squat. Right there where Emily is, that's plenty for skiing. I wouldn't go deeper than that if your knees can't handle it. You will be asked to do 1 minute holds times 2 sets. So at this point, go ahead and relax. And then you will go ahead and do another 1 minute hold and press pause before going on to exercise number 2. Exercise number 2. You're going to turn your feet into external rotation, and you're going to be banded again. You're going to come down into your mini ski squat and maybe a little deeper on this one. And this time it's really important that your knees go out even more, because we're trying to load up those rotators out in your glutes. And then the big toes need to come down and in, so your pelvic floor lifts. Then you're going to keep the ring of your shoulder girdle sitting over your pelvis and open up your arms into a wide Y shape, but without interfering with your torso. So you can see how Emily is still connected from her upper body to her lower body, and she's just starting to get her abs to come in and her back muscles to come in. You can see her chin is coming down the fall line. She's still looking down the fall line. She's not wrapping her back around the ball, and she's gonna hang out there and just perfect all of that. So tail out just a little, knees out wide, big toes go in, shoulders stay relaxed. Feel them lift by muscles through the back contracting, and your chest stays soft over your pubis bone. You will hold this for a minute. Go ahead and rest. And you will now proceed to doing 2 sets total. So 1 more minute of exercise number 2. Press pause and complete that. Then we'll go to exercise number 3. You'll keep the band around your thighs, but you'll go ahead and grab a giant weight in your hand, and you're gonna hold it horizontally out in front of you. So 1 hand on each side and hold it horizontal. And you're gonna come into your little mini ski squat. So perfect mini ski squat. You're over the arches of your feet, knees go forward, tail is going back, torso is vertical. But we're gonna start to simulate what your core has to do here. You're gonna keep your eyes straight in front of you, pelvis straight in front, and you're gonna lower the left side of the weight, and you're gonna take it like it's going down the side of a mountain, and then it's gonna come back up through the same path and lower through the right side and come down the mountain and back up. So basically, you're doing some standing stance ab work, working on bringing in the obliques and the diagonal load that needs to come through the core while you're creating your C curve on top of your edged ski. Keep going, because you're going to do 1 minute of this. Keeping the shoulders relaxed and the chin and the eyes are going down the fall line. Go ahead and relax. You will do 1 more minute of that same exercise, and you'll do a total of 2 sets complete. Go ahead and press pause and complete the rest of exercise 3. Exercise number 4. You'll again start with the heavy weight in your hand. You're going to come into a mini ski squat, and this time you're going to hold the weight vertical. So 1 hand is going to be on top of the other. You're going to actually follow the weight with your torso and your eyes. And you're going to head off to the right first. And you're coming down the slope of a figure 8. You'll come up through the figure 8, and then you come back through the center of the figure 8. Go to the other side, and you can also follow with your eyes if you'd like for a few. It will give you a little more torsion. And then you could do some where your eyes stay straight in front of you, and you'll feel the body being loaded just a little bit differently. So eyes down the fall line versus the whole body spinning. But what we're trying to achieve here is that C curve. And a C curve means that you're side bent and rotated just a tad. And you're going to do about 30 repetitions. And then you're gonna hold the weight off to one side or the other. I don't care which side. Go ahead and choose right or left. And then square your eyes up down the fall line. And then come into your little mini ski squat a little deeper. And you are going to add some bouncing. Keep your pelvis squared up. And so M, drop your left sit bone back. Yeah, so right there, when she just did that, it created more of a spinal side bend. Emily has scoliosis, so she needs a cue for that. So if you have a mirror to do these in front of, you can start to see if your pelvis is squared up and if the torsion's coming around through your center. You'll switch to the other side and you'll do 30 seconds of bouncing on this other side. And on this side, the cue is again to bring your left pelvis forward. And that should bring, there's your side bend on that left side. So again, if you know that you have a hard time in your thoracic spine to move or have scoliosis, and you have a mirror, it'd be great to do these in front of the mirror. After 30 bounces over there, you come back to center. You do one more set of that entire pattern. Go ahead and press pause and finish those repetitions. Exercise number 5. You can drop the weight. You're going to keep the band around the thighs, but you're going to add the TheraBand, and we're going to upregulate the anterior chain. So it goes behind your back at the lowest portion of your ribs. You grab really tight with your palms up to the band, and you push the band straight forward like you're serving a platter, and then open the hands with the palms up, and you'll feel the back of your body firing, but your abdominals will come in automatic. So in none of these exercises do you have to hold muscle control. Now you're gonna come into your mini squat. And this is gonna be a side moonwalk. So the pelvis is gonna stay directed straight ahead, just your toes are gonna head off to the right or left, and then your heels go. And so as you can see, you're gonna keep the band wide through the knees and keep walking. And if you have a hallway, great. And if not, you can decide what the space you have. Then you'll go back the other direction. And you're gonna do this for about a minute. So Em's gonna keep going. She's trying to keep her knees wide, keep her pelvis square, keep her eyes and head and chest down the fall line. And it is interesting because you have to shift your weight from your heels to your toes and keep everything aligned. But it's really great because while you're skiing, you are navigating all of that simultaneously. Main thing is to keep your pelvis squared up and level. Go a little bit longer. And that's probably about a minute. Go ahead and rest. And then you'll do one more minute for your second set. Another way to do this exercise is to perform a swivel squat on a hardwood floor with fuzzy socks. So if you don't have space, you can put fuzzy socks on and you get to stand in place and swivel from side to side like we do here on the slide boards, and you can add the little dynamic bounce if you want. So you can add all kinds of dynamic motion here. Go ahead and complete that second set and press pause. Exercise number 6. You'll keep the band around your thigh. We're going to do a fire hydrant. And these are some exercises from Chris Powers. You're gonna stand on one leg. You're gonna keep the band banded around your back side and press out to the front, just like we did in the last exercise. You're gonna mini squat on one leg, but as you mini squat on that one leg, keep your pelvis squared up. So now the leg that's lifting is lifting to the back corner, but it's through the lower part of your thigh. So it's like the knee is coming up and then it's coming back down. And you're gonna come up and down tiny pulses, or you can do a hold, but you're working for a minute. So the leg that is lifting, that side of the pelvis has to stay low and forward, which is gonna load. Yeah, did you see how Emily's leg on the left has to take more load there? The band in the upper body is helping you stay down the fall line and centered. So you're gonna feel that diagonal torque through both hips and particularly the standing leg. So you're doing this for a minute. So you probably got a little bit longer. Good, there's a little shake going on. Go ahead and rest, and you would perform that on the other leg for a minute, and then you would do 2 sets total, so another set on each leg. Go ahead and press pause and complete this exercise. Exercise number 7. We're going to put the band now out in front and fire up your posterior chain. So now your palms are down and you're about nipple height or a little bit below your shoulders. And you're gonna pull the band outward, which is gonna fire up your back line. Be sure that the band is low enough that your shoulders stay resting. You're gonna come into your mini squat. You're gonna keep your knees wide and you're gonna start to laterally walk. We've done these forever. These are the lateral band walks. And if you have a smaller space, you're gonna go side to side. Be sure that you don't have to bring your feet close together each time because that will take the tension off. I'd rather you keep the feet a little wider. And if you're really not getting the workout you want, you would place a heavier band around your thighs. But you're gonna go for a minute. We seem to have this minute thing going down really well. Keep your pelvis square, knees and toes pointing straight ahead. You stay in your mini squat the whole time. Attempt to keep your eyes and head down the fall line and relax through the shoulders. At any time you feel like you're getting bound up somewhere or you're not getting enough work, you can always change the tension of your bands and that will adjust. When you power train, it should feel good. It should not feel bindy. Yes, you should burn, you should shake. Go ahead and relax. You're gonna do 1 more set. So a total of 2 sets of that exercise. Go ahead and press pause and continue with exercise number 7. Exercise number 8. You're gonna remove all the bands from your body and you can re-grab your big fitness ball, or if this is too difficult for your balance, have a stool, a low coffee table, a chair, something that you're gonna put your back leg up on. This is similar to some of the exercises we do here on the TRX. You're gonna step 1 foot back and up on the ball, the table, the counter, whatever you're planning to use. You're gonna hop the other leg forward to the place where you can keep your pelvis square. That's more than important, or this will create some low back pain. And you're gonna begin by keeping your torso down the fall line, hands out in front of you, eyes down the fall line, and you're gonna do a 30-second hold, and hold your mini squats. You're on one leg or the other. So now the back leg is moving into extension, so keep that pelvis forward on that side, and stand firmly into the standing leg. You'll hold this for 30 seconds, so maybe another 10 or so. So you're also working hip extension on that other side. Then after 30 seconds, you're gonna follow this by 10 super slow up and down. You decide the depth that you go, but I would like you to go all the way straight so that you have to go from initiating the squat to the knee bend. If your knee hurts you, make it a super mini squat. You're still gonna get the hip work, you're still gonna get the quad work. And also remember, the deeper you go, the more you have to keep your pelvis squared up on that back leg side. After you're done with 10 super slow, you will rest. Switch to the other side, and then followed by another full set on each side. So you've got 2 sets unilaterally. Go ahead and press pause and finish out the repetitions for this exercise. Exercise number 9. These are your hamstring deadlifts. You're gonna take your band in your hands out in front of you, shoulder width apart, and your hands will be kind of low. You'll stand on one leg with your hip and knee slightly bent. So you're gonna go into a little tiny mini squat. Now the important part here is that both of your thighs stay at the exact same angle. As you go to bend forward, your tail is sticking up, You're keeping your hands and the band to your thigh, and there's the deadlift position. So you're loading your hamstring there. Now as you come up, you're bringing your pelvis up and forward, keeping the band close to your thighs and keeping your thighs right next to each other. You're gonna move very, very slowly up and down, like super slowly. And you're doing 16 to 20 repetitions. Keep your thighs parallel. The mini squat on one side, coming to mini squat to tall. Hinging at your hips. Emily's doing a good job. Her spine keeps its normal curves. And you're doing really slow hamstring work. After 16 to 20 reps on one side, you will switch to the other side. And then here's a modification for this. You can leave your toe down to the floor and still get work on the standing leg. So if you're having a hard time keeping your pelvis squared up, I would suggest just giving yourself a little toe on the ground. Okay, you will do another set of those. So another set of 16 to 20 reps on each side to finish exercise number 9. Go ahead and press pause. The last exercise in this home program, grab your big fitness ball. Exercise number 10. We will do some hamstring curls on the physio ball. So you're gonna start with the legs all the way out straight with your heels on the ball. We're gonna start with the arms down just to give you some support. You're going to peel up from your tail up into your reverse plank here. Now, you can use your hands to help you keep your pelvis lifted. You are going to press your heels into the ball and drag to the balls of your feet. Yep. And then keep your pelvis where it is and push through the ball and roll it away back to your heels. Really important to go from heels to balls of your feet. Otherwise, you don't activate all the muscles through the back side. You are going to do 10 repetitions super, super, super slow. Now, if that's too easy for you, you can lift your hands to the ceiling and attempt to maintain your pelvis alignment. Yeah, nicely done. And complete your 10 repetitions very slowly, all the way straight, all the way bent. If your pelvis starts to drop, I'd rather you push through the floor than have your hands up. You will be doing one more set of 10 super slow repetitions. Go ahead and press pause and finish those repetitions. Lastly, we'd like to go into some recovery moves, just giving you a couple ideas. If you have a great cool down you love, go ahead and do that. But right from here, you could go into a figure 4 stretch. And now Emily's dragging the ball closer to her, which is going to open up the hip of the foot that's crossing her thigh. We like to hold these kind of positions quite long here. You don't get a collagen change for actually 2.5 minutes. But just make sure you're holding these positions at least longer than a minute. So figure 4 on both sides is a great one. And then the piriformis is crossing your knees completely, so they're in midline, and then hugging those knees towards your body. Really important to keep the pelvis squared up. Both of those moves will help your glutes so that they're not burning tomorrow, hopefully, as much. And then another really nice one for rotation, you can kick the ball out of the way, lay your legs flat, put your palms out, palms to the ceiling, arms out wide. You're gonna kick one leg straight up toward the ceiling, and there's your hamstring. So if you wanna lay here and do some pumps here, kick your tail to the floor. Now draw your knee in towards your chest just a little, and then press your heel back up toward the ceiling. It's really the press that starts to release your hamstring. You could do a few of these. You can also grab the back of your thigh and pull it in tight, and then try to bend and straighten the knee here, but you keep the hip at its angle. So that may not go all the way straight, but it might. Do a few of those. And then we'll go into a spine twist, so your arms will come back to the floor, and you'll take that leg across the body. Your eyes and head will turn in the opposite direction, and you allow the leg to be what draws your spine into a twist. but you're so lengthened out through that bottom leg that it's a very safe way for you to twist without injuring yourself. And you'll just breathe here. I would stay in this one for at least a minute or even longer than a minute. When you come back up, you'll take your rib cage and pull it to the floor. That brings your leg back to the ceiling. I would actually do 2 of those on each side. Other ideas here, you can bend your knees and do some bridging. Just bridging will help your spine cool down. Now if you want to, when you're up here, take the arms overhead and now peel down from here and it will lengthen your lats. So as you're rolling down, your chest is softening and you're peeling down through every single segment, attempting to reach those arms away from your spine. If you want to add some rotation here, you could peel up and then you could lower the right side of your spine, your pelvis an inch and roll down through the right side of your spine, spin around the bottom like when we're doing a pelvic clock, roll up through your left. And do a few of these. Up through the left, down through the right, and then you'll switch that up. And when you get back up to the top on the next one, you'll leave that left side of your pelvis low, roll down through the left side, spin around the bottom, roll up through the right. And then the last thing that we haven't really mobilized here at the end of class are opening up your quads and your hip flexors. If you're in a hurry, just roll to your belly. You can place yellow balls under your psoas if you want to. And then you're going to try to keep your knees really close together, keep the front of your pelvis to the floor, and just gently grab your knee and draw it back. If you can't reach, grab your foot. If you can't reach your foot, you can grab your TheraBand and use your TheraBand. And again, you're trying to keep your thigh to the floor, pelvis level. That will also open up your upper back as well and your chest. And just make sure you do the holds and you're patient. That little routine is pretty good. If you have other things that you like to do, go ahead and do that. And enjoy your home exercise program for ski class. Try to perform this at least 2 times a week in addition to class. Also, cat horse is good, child pose is good, turtle pose is good. Yeah. Okay, enjoy.